Greetings, my name is Dr. Toe, and I'm a physical therapist. Today I'd like to talk to you about how to refuse a COVID test when you're in the hospital. Now more than ever, unfortunately, you and I need to be advocates for ourselves and for our loved ones. And I'd like to share with you 4 pieces of information that I think are very important and when you want to refuse a COVID test in the hospital setting. I am not a doctor of medicine. I'm a doctor of physical therapy. This is not medical advice. This is simply me telling you my opinion and my story of what happened to my mom and me when we were in the emergency room last week. So I'm going to give you a little bit of background first before we start our 4 points. My mom was completely healthy. She's 91 years old, with the exception of having a bacterial bladder infection. She was not sick with any virus. She didn't have fever. She didn't have a cough, congestion, sore throat, swollen glands, headache, nothing that would indicate that she was sick with a virus. She simply had a positive test for bacteria in her urine that was resistant to oral antibiotics, and we had to go to the emergency room in order to get IV infusions for her. So when we went to the emergency room and were being evaluated, the nurse came in and announced that she was going to give my mom a COVID test. So first off, I will have to say that anybody who gives you anything has to inform you of what they're giving you and why they're giving it to you. With this particular test, anybody who's giving you a COVID test has to inform you of the risk benefits. And we'll get into why later. But she did not do that, nor did she ask us if we wanted to have a COVID test, which is also very important. And through a course of discussion, and some of the discussion I'll disclose later, we basically denied the COVID test. And this is the premise of this video, is that you can deny the premise of a COVID test and still get admitted to the hospital. So when we told her that we did not want the COVID test, this is what she told us. She said, "Oh, but you must have it in order to be admitted to the hospital." And we said, "Well, we don't want it." And she said, "Well, I guess we'll see what the doctor has to say." Okay, point number 1, don't believe their lies. First of all, it's not the doctor's decision, it's your decision. You're the patient. You have body autonomy. That means you get to choose what happens to your body and nobody else. Second, a hospital cannot deny treatment to you simply because you deny a COVID test. It's illegal. Now, there are certain instances where hospitals can deny treatment, but they're very rare, and it's things like overcapacity, or they don't have the means to treat whatever it is, or it's a mental health crisis and not a medical crisis. So in this case, it's a COVID test. They cannot refuse to treat you or admit you based on your refusal to take this test. That is point number 1. You can deny this test and not give any explanation as to why. This is your right as a patient. Do not believe their lies. Okay, let's get into point number 2. If you're not sick, you shouldn't be tested. Now, when this nurse announced to us that she wanted to give my mom a COVID test, basically I said, "Why? She's not sick." To which the nurse said to me, "Oh, I've given COVID tests many times to people who are asymptomatic and they tested positive." Which is my point in general, is that these tests are highly fallible. When they're run at high rates, they give false positives very easily. These tests were never designed to diagnose anything. They're being misused. They only are there to tell you how much you have of something, not what you have. And here's my point is my mom was asymptomatic. There's no medical necessity for her to be given this test because nowhere in the history, I'm going to say this clearly, nowhere in the history of the world has anybody ever gotten COVID from somebody who is asymptomatic. This whole pandemic was actually hinged on unreliable and invalid research, and it was like 2 papers, I believe. But nowhere has anybody ever gotten COVID from somebody who is asymptomatic. You have to have symptoms. Hence, this test was medically unnecessary. Hence, if the hospital gave it to her, it's medical fraud because this would make her insurance company pay for something she didn't need. All right. Let's see. Point number 3. If you are sick, let's just say you are sick with a virus, and it's possible that it is COVID, you can still refuse this test. Why? Because, like I said, these COVID tests were never meant to diagnose anything, and they're being misused. But the greater of these 2 points is this, that these COVID tests are still under EUA, which means they're under emergency use authorization. And under U.S. Code 21360 BBB dash, what is it? Hold on. Dash E, conditions and authorizations under 1A, 2, and 3. By law, anybody who is going to administer a COVID test has to tell you the known potential benefits and risks. They have to give you informed consent, first of all. And second of all, and this is where you can still refuse it when you're sick. Not only are they not valid and reliable tests to tell you what you have, and that they have to tell you the informed consent of the risk, but you have to know, and they should tell you too, that you have the option to accept or deny the administration of the product or the procedure. And this is a procedure that is under emergency use authorization. You have every legal right to deny it. And they should give you informed consent, but they don't. So if you're sick, I would tell you it's needless. They're not going to treat you any differently. Depends even why you're in the hospital as to why you're going to get what you're going to get treated with. But if you're sick with a virus, they're not going to treat you any differently once they know whether it's the flu or COVID. They're going to treat you, right? So, and I do have opinions about how you should be treated. And I believe that you should be treated. My opinion is you should be treated the same whether you have the flu or COVID. All right, let's see. Okay, so you're either sick or not sick, and you've refused this test. Point number 4, what happens after you refuse a test? Well, they still have to admit you to the hospital. Now, they told my mom they needed to admit her to the hospital in order to give her IV infusions. And despite what this nurse had told her, guess what? She did get admitted successfully without any problems. No doctor, no test. They simply admitted her. But there is a catch. If you deny a COVID test, the hospital will automatically assume that you have COVID. And they will put you in isolation for 5 days. Now, those conditions should be changing. At the posting of this video, they'll probably be changing sometime in April. And it's probably going to be a 24-hour hold as long as you don't have a fever, depending on the environment that you're in. But as of right now, they would put you in lockdown, in quarantine for 5 days. And then if you haven't shown any symptoms or your symptoms have improved, if you were sick, you hadn't had a fever for 24 hours, they'll take you out of isolation. But here's the thing. Never in the history of the world have we ever quarantined healthy individuals. Anybody who is asymptomatic never got quarantined. And now, since the arrival of COVID, things have changed. And it's actually cruel and unusual punishment to quarantine a healthy individual. So what they are doing is wrong. My mom should never have been put in isolation. And I will tell you that on her door, it said you got to mask up, gown up, glove up when you're entering her room. And every single healthcare provider who entered her room did do that. And I did not, because I knew those things were not going to protect me from a virus. It's impossible. There's no research that supports it. And she was asymptomatic. And guess what? Never got sick. So it is possible to deny the test, and there are a few reasons why you should. Bottom line is you can deny it and not give any explanation. But I encourage you to educate people around you as to why you're denying it and that you do have the right to deny it. Information is power, and you really should know what your patient rights are, because that's where your power lies. So I encourage you to do your own research on a lot of what I've said. And there is something else that hospitals are doing that they won't tell you ahead in advance about. And it's an complete invasion of privacy, patient privacy. And it's arrived on the scene because of COVID. And you need to be on the lookout for it, and you need to be ready to deny it. I'm going to do another video on that, so be looking for it. But until then, I wish you well and good health. And I wish that you would continue to pursue truth, because it's your job to find it. Do your own research, find truth, and you'll find it. This is Dr. Toe, physical therapist, signing off. Thank you.